여보세요?
경미야, 나 어떡해.
왜? 무슨 일이야?
있잖아.
Woman, where will you still stay?
Sorry, I'll make it now.
Now? We're supposed to be done 10 minutes ago before I came home. What are you talking to? Who's that?
너 괜찮아?
You know, your green card wasn't free. Come on, let's go. I'm gonna teach you a lesson.
Girls and young women between the ages of 16 and 24 experience the highest rate of intimate partner violence, or IPV. Awareness and education are important to prevent, assess, and provide care to this vulnerable population.
Sometimes I run out of gas on the freeway and call myself a cab. My favorite TV show got canceled today and it makes me sad, but just a tad. I spilled my drink on my white collar shirt. There's some kids covered in dirt. Girl, is there anything that I can really count on? Well, I can count on her.
Factors that contribute to the membership of women experiencing domestic violence and their health state are upbringing, living condition, and increased stress.
Culture plays a role as well. Cultural factors include social status, gender roles, belief in male superiority, marriage customs, or acceptance of violence as a means to resolve conflict. The health state of someone who is domestically abused can be greatly affected. Abused children are discouraged from the development of normal attachment, autonomy, problem-solving skills, and creativity. And to protect themselves from feelings of worthlessness and fear of rejection, the abused child may form a protective shell and grow increasingly hostile and distrustful of others. Physical symptoms may manifest as hyperactivity, withdrawal, overeating, dermatologic problems, vague physical complaints, stuttering, or enuresis. Battered women often have bruises and lacerations of the face, head, and trunk of the body. They are usually disguised by clothing. Other physical health outcomes include unwanted pregnancy, gynecological problems, sexually transmitted diseases like HIV or AIDS, miscarriage, pelvic inflammatory disease, chronic pelvic pain, headaches, permanent disabilities, asthma, irritable bowel syndrome, and self-injurious behaviors like smoking, unprotected sex, or drug use. Mental health issues may include depression, fear, low self-esteem, sexual dysfunction, eating problems, obsessive-compulsive disorder, and PTSD.
When utilizing the determinants of health model and looking at women and domestic violence, we not only look at an individual's biological makeup, because interaction through social, physical, behavior, and medical interactions influences the health. Significant health risk issues for domestic violence women include chronic pain, neurological problems, and severe physical injuries and/or sometimes death. Here are 3 examples of community-level resources: the Domestic Violence Action Center, the Hawaii State Coalition Against Domestic Violence, or the National Domestic Violence Hotline.
I'm just gonna do a quick assessment with you. I'm just gonna listen to your heart and lungs, okay? What happened? Did someone hit you? No. Just physical. You fell. How did you fall? It's okay. This is whatever we do here is confidential. I'm here to help you. You can tell me. It's fine. I want to help you.
My name is Melissa Mamasik. I'm a public health nurse. I work out actually in the leeward section out on Waianae. So my cases are basically from Makakilo all the way up to Makaha. So there's so many people on the group that's knowledgeable about domestic violence or so. And then just basically like information finding, you know, this issue. Because it is a tough issue to talk with in the community or in any community. Do I think that domestic violence is something we really need to focus on in just the Waianae, the leeward area? I think yes, but it also needs to be focused throughout the islands because domestic violence is an underreported issue. Some people grow up to believe that it's a norm, you know? And they're like, oh wait, your dad doesn't hit your mom, or, you know? Some people grow up and I think it just needs to be addressed that this isn't the way things should be. So
it's not okay.
Yeah, or so, and then and it's a little difficult to talk with the female, or so, especially if her partner is home. You can't really bring out the questions or so. I just let my my families know, you know, I'm here. This is my focus of our visit. I'm always available if you have any questions at all and anything. Like, you know, if you need some resources, I can help you find those resources. So, like, if they happen to talk to me though about domestic violence specifically, then I would try to help them out and, like, you know, kind of ask them, well, what is your plan? You know, do you think your safety is at risk right now? You know, do you need what kind of help do you need? So I kind of just ask them first, you know, what kind of help would you want? Or so. Just try to listen
from there.
Yeah, and then just figure out how to help them from there or so. Because it's a little hard to just say, okay, well, these are the resources and maybe you can call them.
So it's a sensitive
Yeah.
subject.
Yeah, it is a sensitive subject or something. I think, you know, the fact that we want to make things more gender-based to change our way of practice is very helpful. Because we're so set on, I guess these are the guidelines, these are the practices. You don't take into account where these, I guess, people are coming from, you know, you don't take into account their culture, how they're raised or what they know. And I think if we're able to kind of find out like what kind of goals that we want to accomplish in our consortium, then we can best provide services for those who do need it.
Unfortunately, not all domestic violence cases are reported. It is our responsibility as healthcare providers to address this issue not only in vulnerable populations, but in all communities. This can be accomplished through education, implementing appropriate interventions, and providing adequate resources for those affected by domestic